Now, the Department of Health says it has noted with concern a video clip circulating on social media platforms depicting a male patient suffering from what looks like throat cancer, claiming this to be the result of COVID-19 vaccine. In a statement, the department called upon all people who experience any adverse events following immunization to immediately report to the nearest health facility or vaccination site. Now, let's take this discussion further. We are joined via Zoom by Dr. Lesley Bamford, who's the Chief Director for Child Health Program and COVID-19 Team Leader. Dr. Bamford, thank you so much for your time this afternoon. Now, perhaps before we start to talk about just the adverse side effects of the vaccination itself, let's talk about the current death toll as it stands. We're looking at another 119 people who have died from COVID-19. Are the deaths increasing, and what can you attribute this to?
So good afternoon, and good afternoon to the viewers. So we know that the cases are coming down. We are coming out of the fourth wave, but we know that there often is a delay between the increase in the numbers of cases and the hospitalizations and deaths associated with COVID-19. So whilst it is true that there have been far fewer deaths associated with the fourth wave, unfortunately, that certainly doesn't mean that there have been no deaths. So as the number of deaths has been relatively low during the fourth wave, but due to the high number of cases, there have unfortunately nevertheless been deaths associated with COVID during this period.
Now, Doctor, just going into, just today's focus, I mean, we've seen video clips, not only this latest one, coming to the fore in terms of just speaking about people who are suffering from some form of adverse, side effects from the vaccination itself. So please give clarity. What are some of the most common side effects of the vaccine?
Well, we know that mild side effects following the vaccine are relatively common. These are often what we call flu-like symptoms, maybe some fever, some headache, some tiredness, and of course some pain and possibly redness and tenderness at the injection site. So all of these side effects are relatively common, but they do resolve within 24, 48, 72 hours. We also know that more serious side effects do occur. However, these are very uncommon. Now we group what we call adverse events following immunization. So that is any adverse event that is linked in time to vaccination. So it occurs shortly after vaccination. And such adverse events we take very seriously, and they should all be reported so that they can be investigated. And what is very important is that experts look at these adverse events and decide whether they are actually caused by the vaccination or if they are simply coincidental. We are vaccinating many people, and many people will develop symptoms or illnesses around the time of vaccination, but that does not mean that they are necessarily caused by the vaccination. However, that is something, as I say, all of these cases need to be reported so that they can all be investigated, and we can look very carefully and see if there are any patterns emerging and whether we are seeing any unexpected events following immunization. So we take this process extremely seriously. We have been monitoring or investigating and doing the causality assessment on all adverse events that are reported. So really, I think the statement today was just urging both people who are vaccinated, healthcare workers, families of those who are vaccinated, anyone who experiences an adverse event, to make sure that that is immediately reported so that it can be properly investigated. And of course, people should also present themselves to a health facility if they have any adverse event or possible adverse event so that that can be treated and managed appropriately.
Now, of course, there was criticism that was leveled at the department in that, you know, it's too quick to dismiss some of these adverse symptoms that, you know, people are claiming that they have. This video being one of them, of this patient who then, you know, had this bump on his neck, and the department saying, of course, it depicts something that may look like a throat cancer. You've just mentioned now that you take these cases very seriously. If one does report such an adverse case and the department does in fact find that it is from the vaccine itself, can one be compensated when they experience severe side effects?
So we have established a no-fault compensation fund that will allow people to be compensated when it is assessed that the adverse event is in fact related to the vaccination.
Now, Doctor, we've obviously seen a lot of children go back to school today, especially in our inland provinces. I mean, one of your titles is Chief Director for Child Health Program and also the COVID-19 lead. Last year, South Africa saw a rapid rise in pediatric COVID-19 hospitalizations during the early stages of the Omicron wave. Are we likely to see the surge again as kids return to school today?
So we will have to wait and watch very carefully. We know that currently the number of cases of COVID is coming down, and we do expect that trend to continue. So we know, and I think the COVID pandemic has shown us how important it is that children attend school. Of course, they need to learn, but children also, there are many health benefits of children attending school. It improves their mental health. Many children receive nutritious meals at school. So we are very anxious and working with our colleagues in the education sector to ensure that children can return to school and get in as many hours of face-to-face contact in school as possible. We do need to balance that against keeping children and educators safe in our schools. So again, we support our education colleagues in making sure that all the COVID protocols are followed, and we work closely with them to ensure that as many educators and learners as possible are vaccinated. Because as we know, that is the best way that both educators and children and their families can be protected from severe COVID infection.
Dr. Bamford, there's been a lot of calls from various vantage points in terms of, government just relaxing that Disaster Management Act around COVID-19 particularly. We know that the positivity rate is standing at 14% at this point in time. What are some of the concerns that government has? I mean, COVID-19 is now a reality. This is the third year that we are going to, to be living with this pandemic. At what point does government relax all measures that are currently in place and we do treat COVID-19 as part of daily life?
So I think our view is that this is a process. We have started on that road. In terms of lifting the national state of disaster, our understanding is that there are a number of legal processes that need to be followed to ensure that even when the state of disaster is lifted, that if we have another wave and there is a need to temporarily impose restrictions again, that this would that this would be possible. I think our aim as society really now very clearly is to, as far as possible, open up society, open up the economy and get back to some kind of normal. But that is a process that needs to be planned. And as I've indicated, I think we have started on that road and hopefully will proceed during the course of the year.
Is part of that concern the positivity rate that we're currently sitting at, or perhaps that there's still so many more South Africans that need to be vaccinated?
Well, I think it's both. So I think we are coming out of the fourth wave, it would seem. The number of cases is coming down. The positivity rate is coming down. But we know our expectation is that we will continue to experience further waves, and we need to make sure that we have legislation and regulations and systems in place to deal with those waves, even once we have moved out of the national state of emergency, state of disaster.
I mean, we are seeing how the Omicron variant is affecting countries like the United States of America, but also, we've seen several countries in Europe also with extraordinary high numbers. How concerned is the South African government, about what is happening in those countries? Or are you just taking it one day at a time? I mean, one of the concerns is obviously that this might spark yet another variant.
So I think these things always have to be closely monitored. It would seem that as a country, we have come off very lightly with the Omicron variant. We had a very rapid spike in cases, but that was not associated with an equal rise in the number of severe infections, hospitalizations, and deaths. So I think the issue is that we really can't predict the future. It is likely that more variants will emerge, and we will have to respond to those variants based on their particular characteristics.
Just before I let you go, Dr. Bamford, of course, a lot of people also waiting in anticipation to get their booster, shots and injections. Questions raised again about, if you are fully vaccinated, why then do you need a booster shot? And of course, a lot of those that are skeptical about the vaccinations, in the first place, saying that they have lived 2 years without getting, COVID-19. So when are we likely to see those booster shots being administered to the rest of South Africa? And also, how important is it to get that booster shot if you have indeed been fully vaccinated?
So let's just recap with regards to boosters. So boosters are now available to people who are to all adults, so anyone 18 years and older. However, there is an issue around the timing. So with regards to the Pfizer vaccine, that's the 2-dose vaccine, everyone is eligible to receive a vaccination, to receive a booster dose 6 months after their second dose of the vaccine. So bearing in mind that people were first vaccinated in May, and people started to receive their second doses towards the end of June and beginning of July. So increasingly, people are becoming eligible to receive their booster doses because they will have reached that period, that interval of 6 months between the second dose and the time when they are eligible to receive a booster dose. The situation with the J&J vaccine, the 1-dose vaccine, is a little bit different because the interval between the first dose and the booster dose is only 2 months. So obviously, many people received the J&J vaccine more than 2 months ago, and those people are now eligible to receive a booster dose. Why are we offering booster doses? because the evidence shows that vaccination provides very good protection against particularly severe disease, hospitalization, and death. But we know that over time, that vaccination, that protection begins to wane. And so booster doses are recommended to make sure that we top up or strengthen that protection that is provided through vaccination.
Dr. Bamford, thank you so much for your time this afternoon. Really do appreciate it.
It's a pleasure. Thank you very much.